Okay, Brad, is this small, tiny muscle
Mm,
behind your knee causing you some pain or contributing to your pain?
well, we're going to find out.
We're going to find out exactly right.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, we're going to show you a little bit of anatomy here. And Bob was, he's going to actually expose his legs, or he has already. And we drew in where the popliteus muscle is. And this is a small muscle. It connects over here on the lateral epicondyle of the knee. And then it fans out and then connects over to this
The
area,
tibia.
to the tibia. And as it contracts, it adds a little rotation component and some knee flexion. It's not a prime mover. In other words, it doesn't do a lot of bulk work, but it's important for little movements that can cause pain if these little movements are not.
Well, when it
controlled.
spasms, it can
Spasm.
give you trouble.
Yep, and that makes sense. It's similar to a lot of small muscles in
Right.
the body.
So, Rick Olderman, a physical therapist, put me onto this, and he says it often contributes to the pain of the knee.
So you're saying the location of the pain is actually where the muscle is?
Right.
Okay.
And it can cause the knee to, you have trouble extending it, and you have trouble, well, it'll rotate on you.
Sure, sure.
So-
In other words, we get some motion this
So
way.
really easy to tell. All you do is, because the thick part is on the inside of the knee,
Yep, right
you
here.
actually just go over there and feel, is it tender back here?
So
on
is
this
it a
side?
deep muscle you need to actually push in a little bit to feel it? So not just feel the skin, but actually kind of get into the muscle a
Well,
little
I
bit?
think yes.
Yeah.
And if it's tender, you're very simple. You're going to massage it. Now, as you can see, the fibers go which way they go, Brad.
Yep, kind of oblique or
Right.
across.
So you want to massage across the fibers.
Right, so this direction, almost not up and down, but kind of at a 45 there, and we're not going to go with the fibers, we're going to go across. So if you're doing your own leg, it's different than like when I'm doing Bob's.
Right.
So remember, it starts, this is a little confusing to me because it starts here, and then it comes back over here.
Right.
So I'm going to go this way.
Right.
Yeah.
Exactly.
So if it's the right leg,
And
the opposite hand,
you start, casually,
not too aggressive.
not too aggressive, and eventually you get a little more aggressive.
Okay.
And I would say 5 minutes twice a day, Brad.
In other words, until your fingers get so sore you can't do it anymore.
Down to nubs. So, and if it is tender, you'd be amazed at how it helps decrease the pain.
So the whole muscle may not be tender, maybe just part of it.
Sure.
And that's the area where you're going to focus the massage
Right.
on, correct? Yep. Yeah.
Give it a try
You
if you have
bet.
a total knee replacement, or just say if you have knee pain, give it a
Yes.
go.
Yep. If it's there and fits the symptoms, treat away, massage away, and be careful for your
Well,
fingers.
good luck to you.